Welcome, everyone, and thank you for joining us. My name is Chase Small, and I'm a third-year undergraduate at Stanford University, majoring in international relations. Today, we are pleased to share highlights of the findings published in our report, Memes, Magnets, and Microchips, Narrative Dynamics Around COVID-19 Vaccines. This report is the culmination of a year-long effort to understand narrative origins and misinformation spread around the rollout of COVID-19 vaccinations. I had the pleasure to work as a lead analyst and project manager on this project, and I'll be joined today by my colleagues and fellow researchers as we share these findings with you. But before we begin, I'd like to take a moment to acknowledge that last night, Russia launched a full-scale invasion of Ukraine. After some debate, we decided to move forward with today's webinar because we do not think it's beneficial to delay today's report release. I will note that many top experts at the Freeman Spogli Institute here at Stanford, including the Institute Director, former US Ambassador to Russia, Michael McFaul, will be sharing their analysis of the ongoing situation on this webpage here. So to kick off today's webinar, we are happy to be joined by Dr. Seema Yasmin. Dr. Yasmin is the Director of the Stanford Health Communication Initiative, Clinical Assistant Professor in Stanford University's Department of Medicine, and visiting professor at the Anderson School of Management at UCLA, where she teaches crisis management and communications. She is also the author of the book Viral BS, Medical Myths and Why We Fall for Them. Dr. Yasmin, thank you so much for joining us.
Good morning, Chase. Thanks for having me.
So I wanted to start off, Dr. Yasmin, and talk a little bit about your work during the COVID-19 pandemic. You became a key voice on social media, working to keep the public informed. So I was wondering, from your perspective, can you tell us a little bit about why you think false claims and pseudoscience have been so sticky, and share about your debunking work to counter them?
Sure. I mean, I would say that they are designed exactly for that reason. They are designed to be sticky. My frustration, and in fact, why I ended up transitioning from being purely a public health doctor into being a journalist and someone who studies the spread of pseudoscience and health and science misinformation and disinformation, was exactly that. I was so frustrated that those who were designing the misinformation and disinformation, especially the disinformation, were so much better at making those narratives compelling, memorable, sticky, viral, compared to what we in public health were doing. So I used to be an officer in the Epidemic Intelligence Service, and what I saw every time I got deployed to a hot zone was that I was told to have this singular focus on a pathogen. It was never just a pathogen that was spreading. And in public health, I felt we were naive, we were being myopic. And what I wanted to do was really kind of understand the mechanics of what makes these things viral, what makes the counter narratives, the anti-science narratives so compelling. Like I said, they are designed that way. They completely exploit our brain chemistry and our psychology. They really exploit the uncertainty and fear that circulates during times of crisis. So, anti-vaccine movements are not new. Even anti-mask movements are not new. They were around 100 years ago during the 1918 Spanish flu pandemic for the same reasons. Large swathes of the public have been kept out of conversations around how science develops, what the scientific process is. And then at a time when you're trying to play catch up, trying to explain how vaccines can be developed so quickly, for example, you have bad actors, or you have the set of circumstances that lets non-malicious misinformation spread because people are seeking answers at a time when scientists don't have all of that. And, I'm really glad, Chase, that you talked about the invasion in Ukraine to start off our conversation, because it's all connected. The disinformation campaigns that Russia is using to justify its invasion of Ukraine, but also the way that this relates back to health and science. So, for example, one of the pieces of disinformation that we're seeing, I think it was trending on Twitter today as well, was this idea that Russia is justified in bombing Ukraine because it is very specifically bombing these sites that they say are American-funded biological research facilities. People may have seen hashtag US Biolabs. So all of these efforts, all of these strategies are very connected.
Yeah, thank you so much for touching on that. And sort of building off that, really, one of the challenges with debunking is that research suggests it has to be done by a source that's not only authoritative, but trusted by the audience.
Yeah.
And yet, unfortunately, trust in government health institution has really been strained during this pandemic. So how do you think about building that trust?
Yeah, I worry a lot about this because there are large factions of the American publics that have legitimate reasons for not trusting doctors, both historical but also modern day reasons. Large swathes of the public that have legitimate reasons for not trusting government funded research, for example. We talk a lot about Tuskegee now, which I'm glad is part of the conversation, but there's also modern day medical racism. And we're asking those same doctors that many don't trust to be the ones saying, please go get vaccinated. And again, doing this in a moment of crisis when really we should have been laying that groundwork well ahead of time and building bridges. I've done some work with the White House on this, and my strategy has been use the people who are trusted in the community. And that requires some humility from people in the public health community where we feel like, but we are the experts, we know what's going on. We're not the experts in particular communities. We're not the experts in everyone's lived experiences. And what I did with the White House was bring forward community advocates who maybe for a decade or three were HIV/AIDS advocates in their community, were established as mental health advocates in their community, and who had built a knowledge base around COVID. And I think those are the people who are best placed to have conversations with their neighbors, with their community members, the kinds of conversations they're having in the same dialect, using the same language. They look like the people that they're speaking with. They have the same struggles. They can relate to them. I think that's a really important strategy. Unfortunately, what we do in public health over and over is we use a one-size-fits-all message. And this has been studied to the point that we have case studies that demonstrate how this approach fails. And yet, unfortunately, we haven't pivoted away. We haven't deciphered the way to develop more focused, targeted messaging for different communities that actually starts with a process of learning. What are the informational needs of this community? What are their particular challenges? What is the misinformation or disinformation that's really circulating there? Now let's develop a strategy to counter that. We haven't been doing that, and we're not good at doing that.
So to that point, how do you think researchers, governments, public health officials can help ensure that the public has the most accurate information in this age of social media, and especially when this information may change, with updated scientific consensus as we saw throughout the pandemic?
Well, that's a great point that you make at the end, Chase, in that science isn't a bunch of dynamic statistics. Science isn't just a bunch of facts. It's a process, right? Which means by definition, it changes. It's hypothesis testing. And I think we saw how scientific illiteracy plays into this crisis, how scientific illiteracy helps misinformation and disinformation spread. You think back to the very early days of the pandemic, like March of 2020, when you had guidance from senior officials in the US and you don't need to wear a mask. And then very quickly it changed and said, oh no, we've assessed evidence, you do need to wear a mask. That was interpreted by many, for reasons I understand, as, well, the scientists don't know what they're talking about because they change their mind. For those of us in science, it's like, but that's good science. That's what we do. It means assessing the best available evidence and shifting policy, shifting guidance based on what we've learned. But if you have a poor education system, if you haven't taken people behind the scenes of the scientific process, you end up with that set of circumstances where it's very easy for people to doubt science when actually good science is happening, and actually for that misinformation and disinformation to spread. And I think this comes back to the science of pre-bunking and inoculation theory as well. This idea that if you can preempt the incoming myths and hoaxes and conspiracy theories that will spread, then actually ahead of time, you can start developing those counter strategies that will help people build counter arguments. So while we were developing a vaccine in record time, while we were celebrating that actually, wow, it looks like we're going to have COVID vaccines, then at the same time, we should have realized that while that felt like a boon for many of us in the science world and the public health world, to many of the public, it was like, this doesn't look good. How could you develop something so quickly? So then if you start tracing the anti-vaccine messages that spread soon after we had COVID vaccines, we could have preempted that. We could have definitely predicted them and therefore developed strategies to counter that. And yet we didn't. So we worked at record speed on vaccines while completely neglecting to work on the messaging, on the trust building, on the pre-bunking. And I think that's just, it's going to end up another case study of failed public health messaging.
Yeah, yeah, man, we really saw that. Um, and I think thinking about these narratives, more specifically that did come out of this sort of data void, or these maybe separate data voids, community dependent data voids. I'm really curious, sort of in your mind, what narratives and dynamics from this COVID-19 pandemic and vaccine conversation that you think will outlast this period, and what are some of the biggest lessons we should learn from those and about those moving forward?
Yeah, so before I speak to that, Chase, I just want to highlight the fact that you mentioned data voids, which, yeah, very much the case. But also in some communities, it's like a deluge of data, some of it spectacular and some of it complete bunk, and people not having the tools to decipher what's what. And also this kind of like blanket assumption that all of us exist within the same information ecosystems. And actually we don't. So my research at Stanford is building a map of the US to look at the presence of news deserts. So places where local journalism has been decimated and where people perhaps rely on other means to gather information. And I think that's a crucial step before you kind of develop targeted messaging, before you try and figure out what someone needs to know, is what information ecosystem do they exist in? Are they getting their public health and vaccine messaging off WhatsApp, or are they getting it from a really credible local newspaper that's fact checking, that's debunking? And I think we haven't seen that before. We haven't seen America's information ecosystem mapped before. But as we're doing that now, we're seeing correlations between your access to information and the quality of that information and your likelihood of being vaccinated for COVID-19. And we're seeing if you're an American who lives in a news desert, you are less likely to be vaccinated. So I think that's going to be an important thing to continue looking at in terms of lessons learned and what we should shift moving forward. I hope we realize the importance of building scientific literacy, because there will be more pandemics, there will be more public health crises, there will be more of these incidents that requires the public to be aware of the process, aware of what's going on. And we've seen how difficult it is to build that kind of literacy and trust in the midst, in the epicenter of a crisis. So I hope that shifts. And I hope that as much as we've started talking more and more about disproportionate morbidity and mortality amongst people of color and Black and Indigenous people, and understanding that's because of socioeconomic issues, because of the built environment, that we also factor into that information access and information equity as a social determinant of health. So understanding whether it's COVID, the next pandemic, whether that's flu, another novel coronavirus, your chances of getting sick, your chances of dying are also impacted by what kind of information you have access to. And so I really want to see us working towards building equitable information systems that protect people, that build immunity against the spread of misinformation and disinformation.
Yes, well, thank you so much. And thank you so much, Dr. Yasmin, for both sharing your research and experience and also really contextualizing this report, because this is, as you're saying, all part of this information ecosystem. And I am personally, as a student, I'm very excited to learn more about the pitfalls of our constantly changing information ecosystem.
Yeah, so, thanks so much for having me, and thanks for all of your work on the report.
Really appreciate it. Thank you, Dr. Yasmin. And so now I'll turn it over to Lily Meyersohn. So Lily is one of the lead editors on this report, and she will be discussing more about what the Virality Project was and what our research discovered. So turning it over to you, Lily.
Thank you, Chase. And thank you, Dr. Yasmin, as well for the talk. So for those of you who don't know much about the Virality Project's work, we were a coalition of researchers that spent the greater part of 2021 analyzing and then responding to incidents of online mis and disinformation related to the COVID-19 vaccines. And after all of that time researching, we then wrote our final report, which we're celebrating the publication of today. And today we're mostly going to devote our time to the findings from the project report and focus on 4 main chapters, though the official report includes a very informative introduction that gives some of the more academic and historical background to our research, And we also discuss the structure of the data collection and analysis. And then the report also dives into statistics around community engagement and narrative trends and that sort of thing. There are also specific sections on non-English actors and narratives and foreign state influence on the vaccine conversation that we won't discuss today too much. But what we will discuss today is 3 people and then myself. The first is our colleague Cameron Hickey from the National Conference on Citizenship on the Narratives chapter, then Kaitlyn Dowling on actors and tactics, and then Renée DiResta from the Stanford Internet Observatory on platform policy. So I'm handing it over to Cameron now.
Awesome. Thank you so much, Lily. So I'm the director of the Algorithmic Transparency Institute at the National Conference on Citizenship. Our team developed tools to support social media monitoring and reporting for the Virality Project. We also provided monitoring support specifically in Spanish and Mandarin around various incidents that we saw over 2021. And we contributed to the Virality Project weekly briefings. Today, I want to walk you through the key types of narratives that drove the incidents that were collected over the course of the Virality Project. While there were hundreds of unique narratives tracked over the project, they all fell into one or more of these 4 categories. Narratives related to safety of the vaccine, narratives related to the efficacy of the vaccine, narratives related to the distribution of the vaccine, and narratives connected to conspiracy theories about the vaccine. It's important to note that in many cases, the incidents and narratives that were identified could relate to more than one of these categories, in particular, conspiracy, as we'll discuss in a moment. So first, let's talk about safety narratives. These were all incidents that in some way reinforced the idea that the COVID-19 vaccine is not safe, that it is dangerous. As soon as the first vaccines were administered, we saw viral videos where people shared their first-person accounts of side effects they experienced after getting the shot. There was no evidence to prove the relationship between the shot and the side effects, or even to verify if the side effects were real. But because these kinds of videos were graphic and emotional, they went viral repeatedly. In addition to the first-person videos, there were many posts and articles that amplified stories and fears about a wide range of unsubstantiated side effects, from paralysis and stroke to death. Further, because the mRNA vaccine uses a new and complicated technique related to DNA to create immunity, that led to a range of narratives about how the vaccine alters a person's DNA. Other narratives we saw frequently cited real and imagined ingredients as toxic and creating risk. Frequently, we also saw concerns that the vaccine was rushed and not properly tested, which, while vague, further reinforced concerns that drove hesitancy. Finally, a key feature of the safety narratives was the frequent citation of the CDC's Vaccine Adverse Event Reporting System, or VAERS database. This public and self-reported database of vaccine side effects provided statistics that were frequently used without context to falsely implicate the COVID-19 vaccine as the cause of various adverse health events. A related set of narratives, which is on the next slide, that we saw focused on the efficacy of the vaccine, or more specifically, arguing that the vaccine simply doesn't work. These are popular narrative themes that still persist today and are even mistakenly reinforced by legitimate research, arguing that natural immunity from a COVID-19 infection is superior to immunity from the vaccine. We also saw a range of arguments that connect the existence of booster shots, or outbreaks in highly vaccinated places, or breakthrough cases generally, as evidence that the vaccine simply doesn't work as advertised. These efficacy narratives could often co-occur with the safety narratives that I mentioned earlier to provide a sort of 1-2 punch of it doesn't work and it will hurt you. The next bucket of narratives we saw came in incidents that relate to the distribution of the vaccine. In this category, we include narratives that discuss the profit motivation for the production of the vaccine and various narratives that we see frequently right now around the compromises to our freedom implied by vaccine mandates and vaccine passports. When the Biden administration referenced a door-to-door campaign to encourage people to get the shot, that was twisted into messages implying significant overreach by the federal government. The broad theme that many of these messages still carry today can be summed up under the term medical freedom. This concept predates COVID-19 in general and has long been a rallying cry for anti-vaccine activists. In addition, we also include arguments here that the vaccine itself violates the Nuremberg Code, which is a real code that restricts compulsory medical experimentation. This links distribution narratives, for example, to one of the issues we heard at the top from Dr. Yasmin around the Tuskegee experiments. So these three, the first three that I mentioned, safety, efficacy, and distribution, all frequently connect to our last topic, the category of narratives that are in some way or another about conspiracy theories, or in some way arguing that something else is going on related to these vaccines that we should also be scared or paranoid about. These narratives frequently link the virus or the vaccine to the ulterior motives of powerful people and institutions. They often appeared in content that contain narratives about the other three buckets. For example, the vaccine is dangerous because someone powerful wants to harm the public for a specific reason. From claims that the vaccine represents the biblical mark of the beast, to claims that the vaccine itself is a bioweapon or contains a tracking microchip, these narratives reinforce underlying fears about the covert goals that entities like the World Economic Forum or Bill Gates have in the development and promotion of the vaccine. We also include here the other key title inspiration for the report, the idea that the vaccine is responsible for making people magnetic, which I'll give a brief walkthrough and explain how even this rather absurd hoax becomes a problem. So back in early May of 2021, a video intended as a joke went viral, showing someone sticking a magnet to their shoulder in the spot where they would have received a vaccination. This viral video inspired a social media challenge to get other people to see if their own arms were magnetic too. They shared these challenge videos back to social media, where they were then amplified by a range of familiar anti-vaccine influencers like Del Bigtree. This resulted in numerous copycats, mashups, and compilation videos, and even propelled the concept into mainstream media and late-night comedy fodder. However, what started out as, and should have ended up as a joke, was frequently taken seriously, reinforcing the range of hesitancy narratives we discussed earlier around safety, foreign contaminations like microchips, and their associated conspiracy theories. Worse, it even resulted in the claim making its way into the testimony before the Ohio State legislature, where it was cited by another familiar actor, Sherry Tenpenny. This is just one of the many examples of how, through the Virality Project, this partnership identified and tracked the flow of these recurring narratives across social media and analyzed how prolific influencers contributed to their amplification, which is what Kaitlyn is going to walk you through next.
Hi, everyone. Thanks, Cam. My name is Kaitlyn Dowling, and I'm a senior analyst at the Algorithmic Transparency Institute, housed at the National Conference on Citizenship. Today, I'll be talking about the actors and tactics we observed during the Virality Project. These people are the real lifeblood of disinformation related to the COVID-19 vaccines online. They were the group responsible for the heavy lifting of producing, sustaining, and spreading this content. I'll talk today about the ways that we categorize these actors, but it should be noted that these aren't hard categories, and content from one category is often shared across others. Anyone who has spent time looking at mis and disinformation around vaccines will likely recognize a lot of the names and faces across these categories. First, we'll talk about long-standing anti-vaccine influencers. These actors were creating content and building audiences for years prior to the emergence of COVID-19. Some go beyond being just influencers and content creators. They're actually activists who participate in both political and legislative advocacy. They frequently receive high engagement on their content and are also frequently translated into other languages. Robert F. Kennedy Jr., one of the largest anti-vaccine voices, used his name recognition and influence in the space to organize around larger goals. For example, the citizens petition he co-filed on behalf of Children's Health Defense in May of 2021, asking the FDA to revoke the EUA for the COVID-19 vaccines. Though this effort was unsuccessful, and it's hard to say exactly how influential this one campaign was in the anti-vaccine space, RFK Jr. was able to mobilize other actors around this action, and the legal filing lent a facade of credibility to their false claims. Wellness and lifestyle influencers are a somewhat diverse group that can include folks like parent bloggers, yoga instructors, dietitians, health coaches, natural supplement purveyors, and sort of catch-all new age influencers. Their focus is on healthy, clean, natural living. And some were anti-vaccine before the pandemic, but most of them were, or not most, but many of them were not. However, mistrust of the medical establishment runs really deep in this community, and that primed them really well for misleading and conspiratorial claims about COVID and vaccines. This group was most active on Instagram and in Facebook groups, and they're very social media savvy. They're great at evading moderation by doing things like misspelling words or obscuring words that they think might trigger automatic moderation. For example, here we see the word Maxine replacing the word vaccine. Pseudomedical influencers have a background in medicine or science, and they leverage their perceived expertise and credentials to undermine vaccines. Many come from alternative health backgrounds like chiropractors and naturopaths, while others are MDs or DOs who speak on topics they don't necessarily have authority on, like virology. And along with leveraging their perceived credentials, this group often uses manipulated statistics. They cite studies and discuss trial results that are hard for the average person to interpret or verify. Here we see Dr. Joseph Mercola sharing a decontextualized quote from a study at the University of Washington School of Medicine in St. Louis, which found that COVID-19 antibodies induce lasting protection against COVID. And he says, quote, "Good news for everyone except the vaccine manufacturers." This group's claims are often amplified by actors in other categories, and their content was really potent. 21% of all engagement during the Virality Project could be attributed to this one group. Next, we have conspiracy theory influencers. These actors have built their followings by discussing myriad different conspiracy theories, undermining audiences' trust in government and in the medical establishment. They often talk about COVID-19 vaccines as part of a larger agenda of control by some nefarious enemy. And though these incidents only comprised 20% of everything we found during the observation period, they accounted for 37% of all engagement. They're most popular on alternative platforms and messaging apps like Gab, Rumble, and Telegram, often because they've been deplatformed from the more mainstream sites. But of course, as we know, these conspiracy theories can still make their way to the mainstream sites and are often shared by other types of actors. Michael Yeadon, who's a former Pfizer vice president, pushed a lot of misleading claims about the COVID-19 vaccines, but sort of rolled them all up in this larger conspiracy theory, claiming that vaccines were a depopulation tool. Right-leaning political influencers. This group is composed of both mainstream and more fringe and alternative right-leaning media figures, influencers and content creators, politicians, and broadly publications. A lot of them are multi-platform. They're on cable TV. They've got blogs, podcasts, video, and social media presences. Tucker Carlson is probably the most notable actor in this category, and his show on Fox News gives him incredible reach. He doesn't call himself an anti-vaxxer, but he definitely hosts a lot of segments that are very clearly anti-vaccine, and he doesn't encourage his viewers to question the COVID-19 vaccines. Lastly, we have medical freedom influencers. This group is focused mainly on government interference in people's lives. They advocate for what they call health freedom or vaccine choice. They appeal to their audiences by highlighting misleading claims of adverse events. And during the pandemic, these groups really zeroed in on misleading claims around mandates. Groups like the Freedom Keepers use a franchise model to expand their geographic reach and help gather momentum for in-person events. And though these groups don't necessarily have as much reach as like a single big influencer, they do help amplify each other's claims across the different sort of local groups and the national group. We also tracked content about COVID-19 vaccines in Spanish and Chinese language communities. Mis and disinformation in languages other than English is very much understudied, and we felt that this was an important thing to do. However, there are a couple of challenges with tracking foreign language content. First is the volume. We had a limited number of analysts with foreign language proficiency, and we just couldn't possibly capture and analyze all of it. Second, a lot of conversation in languages other than English happen in closed spaces like WeChat, which is based in China, and WhatsApp, which is super popular in Spanish-speaking communities. And they're a lot harder to access than mainstream open platforms like Facebook and Twitter. A large amount of English language content that spread in Spanish and Mandarin speaking communities was translated from English. Some of it was word for word translation, which is really time consuming to do, but others, to sort of speed up their process and keep up with the real narrative zeitgeist around vaccines, would link to an English language source and then provide an in-language summary for their audience to help them understand what the article was about or the video was about. Or they would, pull a decontextualized quote from the article and translate just that. And we saw translated English content in Mandarin and Spanish from actors across every category. There were a couple of unique actors that I'll touch on, though. One was Natalia Priego Cancelo. She's a family doctor from Spain who rose to prominence spreading misinformation about COVID-19 very early on in the pandemic. She also became a spreader of disinformation and conspiracies about the vaccines. She founded a pandemic skeptic group called Médicos por la Verdad, and they helped to amplify her claims on Telegram, where she's most popular and most active. Similarly named groups, though not formally affiliated with hers, also help spread her messages all across Telegram and Twitter. In Chinese, Guo Wengui and Yan Limen, we saw spreading a lot of vaccine misinformation. Guo Wengui is an exiled Chinese businessman who's been critical of the CCP and frequently spreads disinformation about COVID-19 and a host of other topics. He runs a network of media properties in multiple languages, including Mandarin and English. Among other claims, Guo and his network, which included American political operative Steve Bannon, actually, amplified Chinese scientist Yan Limen, who claimed that SARS-CoV-2 was created in a lab by the CCP as a bioweapon. She claimed that only the CCP holds the antidote to COVID-19 and thus vaccines could not prevent illness. Her medical degree lent her credibility, allowing Guo and Bannon to elevate her claims. Guo's influencer status among those critical of the CCP, along with his massive reach in multiple languages, allowed her claims to spread far, including to English-speaking American audiences. And lastly, I'll just touch on this. The Virality Project included a pod of researchers responsible for tracking conversations by state media actors targeting COVID-19 conversations with misleading claims. Russia, China, and Iran all use a full spectrum propaganda approach to influence public opinion. That being said, the volume of this content that we observed was much smaller and less frequent than domestic content creators. And I'll hand it off to Renee now.
Hi, everybody. I'm going to talk a little bit about the platform policies that came into play during this environment that my colleagues have spoken about. So one of the unique dynamics that we've seen now in so much of our work, and I think the mis and disinformation research community can say this more broadly, is this idea that policy shapes propagation. That there are people who want to create content, they want to express themselves, and platform policies largely set the guardrails around what is and is not acceptable content, or what are or are not acceptable means and behaviors by which users can spread it. So for those who are unfamiliar, there's a policy framework. The terms kind of came from Facebook, but they are fairly broadly applicable across the entirety of the social media platform environment. And when platforms create policies, they also have to create enforcement mechanisms for applying the terms of the policy to their users. And so there are three mechanisms by which this is usually done. The first is what's called remove, and that is what it sounds like. The content comes down, potentially if repeated often enough or if significant enough, the actor posting it comes down. So as Kaitlyn was mentioning, some of the actors, particularly the core anti-vaccine activists, saw a lot of their stuff removed. Go back to the prior slide for just a second. There we go. The second piece is reduce, and that's where the platforms decide that they're going to throttle the distribution a little bit. This is one of the areas in which this became quite prevalent in COVID-19 and COVID-19 vaccine conversations, is it gives fact checkers time to go and see if something is real or authentic, or if an incident has actually happened. And so reduce provides an opportunity for the platform to not go so far as to take something down, but to use this kind of middle tier approach to try to prevent it from achieving significant virality while people try to figure out what's going on. And that should say inform, apologies for that, but remove, reduce, inform. And in inform, what we have is a dynamic in which the platforms are appending a label or a fact check, something where oftentimes after reduce has happened, and fact checkers have had time to understand what's happening, you'll see them put an informed label on. So this is the sort of environment in which the platforms are operating. And on the next slide, one of the things that I'd like to do is kind of contextualize this, because there's a lot of commentary about platform policies and what they should have done or could have done during COVID-19 specifically. One of the things that I think people need to be very aware of as we have that conversation, particularly as we take this particular incident and this particular moment in time and apply a forward-looking lens to it, is understanding how the platform policies evolved over time. They did not, in fact, spring up in response to COVID-19. Many of them actually were developed in 2019 during several major measles outbreaks, one in Brooklyn, New York, and one in American Samoa, in which there were very significant hospitalizations. And in the case of Samoa, about 87 fatalities, mostly children under 5. There were congressional hearings in which the Senate asked the platforms to explain what their policy was towards vaccine misinformation, because by this point there had been a realization that there's hesitancy and there's freedom of expression, but there's also a precipitation of harm. And so how should platforms balance that equity, those trade-offs between people's right to free expression and the downstream harms that appeared to be happening as MMR hesitancy and childhood vaccine hesitancy spread, leading to more and more outbreaks? So over time, particularly throughout 2019, what you see is different platforms beginning to take different approaches, trying things out to surface authoritative facts. Interestingly, this model of surfacing authoritative facts largely means surfacing institutionally authoritative facts. And so what we see are results instead of, if you search for MMR on Facebook, rather than finding an anti-vaccine parent group, you're taken to results from the World Health Organization or the CDC. This at the time seemed like a really strong, solid policy. And so that was the policy that carried forth into COVID. But as many people saw, and as there was a lot of, many people during COVID-19, far more than parents interested in childhood school vaccines, began to search for information and they found data voids because the World Health Organization and the CDC were not always communicating as quickly or with material as well suited to social media as some of the commentary put out by the influencer types that Kaitlyn talked about. So the policies that were created in this environment where there was a strong certainty, deep confidence in the MMR vaccines, years and years and years of data and research kind of bolstering them and backing their efficacy, we see that begin in the context of COVID, where there are no vaccines yet, where things are very new, where various treatments are being floated as a potential option. The platform choice, the platform policy to try to surface authoritative information and to remove, reduce, or inform less authoritative information comes to be seen by many members of the public as censorship. And so there's this interesting series of trade-offs as the platforms are asked to moderate, to minimize the spread of false misinformation. And this particular image by our former colleague Carly Miller, and several going forward in the report kind of really detail this timeline. We have a long appendix of every conceivable platform policy change that happened, so people can understand the evolution of how we got to the moderation regime that's in place today. On the next slide, what I have here is research done by Carly, in which she and the team, the pod that looked at policies, meticulously went and tried to ascertain to what extent platform policies and platform moderation were in sync, and to what extent platform policies covered the various types of incidents and claims and narratives that analysts, as part of the Virality Project, were observing. And so in this particular case, you'll see that there are some remove policies that specify specifically content that will lead to physical harm. Again, this idea that there is some sort of really negative consequence of certain types of information. So you see remove policies kind of across the board there. Removing content that runs counter to public health expert consensus. This is an extremely hot topic. This is there's some real questions there. And so some platforms have quite transparently articulated policies in which they lay out what they're going to do, how they're going to enforce, what the moderation frameworks are going to be, while others do not lay that out quite so clearly. It doesn't mean that they don't do it. Sometimes the policy isn't articulated because then the platform has some leeway if it tries to enforce about a particular emergent crisis. But it is an interesting dynamic as researchers try to understand what kind of content can propagate during these sorts of information, information confusion environments. Similarly, the clear strike policy, as Kaitlyn mentioned, and as many of the actors that produced the narratives that Cameron discussed were longstanding anti-vaccine influencers who had repeated success, if you will, at making false and misleading claims going viral. Some platforms have strike policies where they lay out how many times a particular actor or entity can make demonstrably false claims before they come down, and others do not, or others are sort of vaguer or more in the evolutionary phases of development. So this is just one example on remove policies, but Carly and her team really looked through all of the different types of policies related to COVID and all of the types of enforcement: remove, reduce, and inform. And on the next slide, one of the things that really came about as we were doing this work and understanding this kind of policy evolution and then the subsequent moderation frameworks was to say, what are the areas that just weren't covered by policies? Where are the areas where the public perhaps has to understand, the media has to understand, researchers have to think about the ramifications of the nuances in the particular types of content that tend to come out in vaccine conversations? As Cameron noted, very few of the narratives that emerged in the vaccine conversation were really new or novel. They were inflected for COVID, but they were very much based on longstanding tropes, claims that had been made about vaccines in childhood, childhood illnesses, going as far back as the smallpox era. And one of the things that we've seen for a very, very, very long period of time throughout that long history of immunizations is this the notion of the personal story, the personal anecdote, a person describing their lived experience. And in prior media environments, the person describing their lived experience maybe got some airtime if they were interviewed by, for example, local news or maybe a national morning show program or something. But the media was much more kind of in control of those conversations and whose story got to be told. That also meant that media was theoretically doing some fact checking and trying to make sure that the person that they had on was representing themselves accurately. But in the age of social media, we now all have the power to tell our stories. And again, this is the trade-off section of this report that really gets into that nuance of how should a platform treat a claim that is not necessarily falsifiable. It's certainly not something that a public health official can go and fact check or that a media organization can go and fact check. And so one of the nuances in the policy is, how do we maintain that freedom of expression? How should platforms think about maintaining that while at the same time creating this opportunity where there's also some consideration given to the fact that false or misleading narratives can engender hesitancy? One of the things that this report tries to do is to articulate that nuance, to really lay it out there and ask if platforms are the place where this kind of nuance should be managed, or also are there opportunities for counterspeech for physicians such as Dr. Yasmin and others to try to understand the dynamic of viral, nuanced personal stories and to respond to them as in the best way possible, as opposed to trying to moderate them. Another challenge that came up quite a bit was elevating authoritative sources. And that's an example of the pseudo-medical influencer and the question of which doctor is most accurately representing medical consensus. This was one of the real key challenges that platforms had. And it's not always clear how they should be thinking about that going forward. One of the interesting dynamics is that authoritative voices are not necessarily those with the largest audiences. Oftentimes those with very large audiences are those who are simply the best at communicating highly emotional or inflammatory information. And so there's this question of how should we be thinking about influence? How should we be thinking about surfacing authoritative sources, and also broadening the notion of authoritative sources beyond solely institutionally authoritative sources? And you can see in this image here, Pinterest, for example, has chosen to handle searches for medical freedom by saying this is not something that, this is not a topic that Pinterest wants to surface and amplify and inadvertently carry. And so they choose to quite transparently put out where they stand on this particular nuanced issue, these questions about what should platforms curate or amplify versus what do people have the power and the empowerment to create. And the final slide I'll just briefly mention on the question of remove. There's a lot of people who are very curious about the impact of deplatforming, and the jury is still out on that a little bit. We are continuing to do ongoing work at SIO looking at that question. There's a real trade-off in deplatforming that I think is important for the public to understand, and that is that a lot of the time, influencers who are spreading content that they know violates platform policies will kind of direct their audiences to where they're going to go next. And in some ways, being deplatformed is like a badge of honor among certain communities. And so they kind of lay the groundwork. They're saying, we're going to be on Telegram. You should follow us here, find us here, ahead of our inevitable deplatforming. And so that also kind of creates a perception of them as these, willing to break the rules for truth. And so you see that dynamic quite a bit. One of the things that appears to happen with deplatforming is that the users will, some of the kind of most entrenched or users who really deeply believe and feel a strong affinity for the influencers will in fact follow them to other platforms. Some of the work that we're doing now is asking the question, when they are no longer constrained by particular policies, when remove, reduce, and form no longer constrains their behavior, what happens to the content they produce? And that's some of the ongoing forward-looking research as we try to understand the ways in which policy shapes information propagation and how remove, reduce, and form and policy and moderation interact to create a healthy information environment. And now I'm going to turn it over to Lily.
Hi, everyone. So I'm going to go over the final section of the report, which is just the recommendations. Our report put forth recommendations for 4 groups of stakeholders that the Virality Project worked with. So that was research institutions, public health partners, government, and social media platforms. We ultimately see our recommendations as kind of providing various interrelated cogs in a whole of society approach to combating health mis and disinformation, but we do hope that this work can be useful as the coronavirus pandemic continues to evolve, and that the recommendations might ultimately be used in other contexts as well. So we gathered our recommendations based on discussions with our VP analysts and researchers about what worked and didn't work during the period of data collection. And we also looked at feedback that we received from stakeholders. And I'm going to briefly walk through the 4 categories. So the first recommendations on this slide are for our research partners. So researchers studying social media can better understand the dynamics of emerging mis and disinformation narratives by improving upon 2 main things. The first is that researchers need to streamline the tip process so that civil society and government can quickly and efficiently share observations that they're seeing. And then the second thing is that researchers need to establish a feedback loop to determine the specific types of analysis and tips that are most relevant for the public. The second group of recs on the next slide are for public health partners. And obviously, public health partners are in a unique position to provide trusted information to communities. And they can leverage this position through very strategic, gold standard science and health communication techniques. Sorry, let's just see. I see. And that means that they should focus on misinformation themes and tropes rather than fact-checking individual incidents or stories. They should definitely be transparent with the public about known unknowns and areas of scientific uncertainty as those things evolve. And they should also communicate personal stories about vaccine benefits alongside data. Standalone data has been shown to be less compelling as counter messaging. The third group of recommendations is for government partners here. So that means that all levels of government, federal, state, and local, leaders in all of these 3 need to position themselves to counter harmful misinformation where needed. This means developing and maintaining clear channels of communication so that agencies can understand what is happening in other regions. And that might be through ISAC's information sharing and analysis centers. Government also needs to address vaccine hesitancy in underserved communities through collaboration with trusted voices. But that means building and those collaborative relationships proactively over time, not just calling upon them in times of crisis. And we also recommend establishing a rumor control mechanism to address nationally trending narratives, and establishing a misinformation, disinformation center of excellence, which ideally would be housed within the Security and Infrastructure Security Agency, which is something that SIO has written on and advocated for in the past. And then last, but certainly not least, we have recommendations for social media platforms. So next slide. Platforms' role is obviously very critical, as Renée said, in helping stop the flow of false and misleading claims. But again, platforms face a number of challenges in moderating that content. So platforms working against public health misinformation need to be clear, precise, and perhaps most importantly, they need to consistently apply their moderation policies, particularly against reoccurring actors who violate policies. And we also urge platforms to continue to improve data sharing relationships with research institutions, which will ideally make this work smoother and more comprehensive. Those are all of our recommendations for today. I think to sum up, it's important to reiterate that, of course, it is ultimately the collaboration on the part of all of these groups that will make for the healthiest information ecosystems and the healthiest public writ large. And that is everything for today. I want to conclude our discussion by just saying thank you for everyone listening and participating today to hear about the work that we did through the Virality Project and in the report.
Thanks so much. I see we got one question in the chat. Is it important consideration here whether messengers are profiting by the ideas? We actually do discuss that in the report. Since we only have a few minutes left, what I'll say on that topic is that there are various motivations for the actors who participate. Some of them are deeply ideologically motivated. Some of them are deeply convinced. Others do have something to sell. And so that dynamic is discussed in the actors chapter as we try to get at the question of motivation and what inspires people to participate or really to influence, to try to drive and shape opinion in the COVID vaccine conversation. If there are no other questions in the chat, or I see one coming into the Q&A now. Zoom is always an adventure. What sort of data sharing do you think would be most appropriate and what would have helped you? That's a really fantastic question. One of the interesting dynamics, of course, is that we can see data that is publicly available. So, for example, things that are coming through the Twitter API or things that are coming through CrowdTangle. So we only look at information that is in public spaces. And as my colleague noted, in the context of information in WhatsApp and in chat groups, that's really wholly invisible in many ways. And so that dynamic significantly shifts our ability to understand how particular communities are impacted by particular narratives. One of the challenges, though, even in open spaces, is that we can't really see impact. There's a chapter in the report, I believe it's chapter 2, and it's really about statistics, and it discusses engagements. And we really lean into talking about engagement data and how certain narratives got very high engagement or certain tactics were particularly efficacious at making something go viral. But engagement is really all that we have. And we try to describe the extent to which that's actually a very imprecise metric, because you can see that something got a lot of likes, but you can't see if that persuaded somebody or if they were already convinced. You can't see if that was novel information that they engaged with because they found it compelling and shared it because they found it compelling, or if you could see the text of the share, it would say something like, look at this ridiculous idea, right? And so there's a real lack of understanding beyond just dynamics of networks and engagements, how information is influencing us. And that's where you do see, for example, whistleblower reports from the Facebook whistleblower that get into a whole lot more detail that really surface the research that data scientists and sociologists and others inside platforms are doing to try to better understand behavior on their sites. So really a different degree of understanding internally versus what we can have from outside. And so that's where one of the increased access to data or more transparency could potentially help researchers like us and others continue to do our work with a fuller picture. And since we are coming up on time and I don't think I see any other questions, I just want to take the opportunity to really say thank you to all the Virality Project partners, all my colleagues, particularly the incredible number of student analysts who are all listed in the report, who did an incredible amount of hard work, both on the research over a period of months and then also in helping us write this report and helping us put this story out to the public, helping us shine a little bit of a light on the dynamics that took shape during this critically important period for our country and the world. And then I want to thank all of you, the audience, for joining us today, particularly on this very challenging day for many people. And I would encourage you, please, to go and to download the copy of the report. The URL is below, viralityproject.org/final report. That's our team Twitter handle. And please reach out on Twitter or an email if there are any questions that you have that we didn't get to or address during this webinar today. So thank you very much for your time, and I hope that you all have a wonderful rest of the day.